King. This is blog number 4. Being a community health science major, program planning is something that we will most likely encounter if we choose to work in the public health field. It is the ability to plan, organize, and facilitate a program from start to finish. If it is not possible to finish the program, then as a public health worker, you should be able to implement the program and get it into a running phase. In my field studies, I have been responsible for setting up a grant writing workshop. The executive director told me what she wanted from the workshop, that I need to find a webinar program that is free, allows us to record at the same time, and one that is easy to use. Although that was a small fraction of program planning, through the research I have been doing for new organizations to send an invite to for this workshop, I have learned how detailed program planning truly is. The classes I have learned about program planning would be CHS 101 and 102, as well as CHS 360. During my field studies for this class, I was involved in an autism spectrum class at a local elementary school, and I saw the health programs that were implemented in this school. Systems thinking is something that has been explicitly discussed in majority of our CHS classes. I learned about this in CHS 345, Ethics and Professionalism. I took this class from Dr. Boutte, and systems thinking was discussed during our ethics portion of the class. I learned that to reach a minority population that doesn't have the ability to seek medical services for whatever reason, you need to reach out to public entities that are not medically based. For example, reaching out to churches or other places that people gather at. One of the areas that Susan G. Komen is trying to increase their services to is Latino women in rural Nevada. I have been suggesting that they reach out to other organizations that the population cannot seek medical treatment from to bridge a gap for this population. By letting these non-medical organizations inform them that these specific medical clinics or providers in their community offer these services at a free or reduced cost for women would help allow the grant money to be reaching a larger base. As far as my field studies is going, I've been working on finalizing the RFA list and getting it into a format that they can pull information out of and make a mailing list. We're a little less than a month away from the grant writing workshop, so I've been finalizing my portion for that. Thanks.